Check, 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 check. Hey guys, it's good to see you all today. I gotta tell you, I have been working out of my basement office for 2 straight years, so this is awfully different, but it feels so good to be back. So I'm really happy to be here today talking about AssistRx. My name is Brock Vanderstein. I'm the VP of Business Development, and today we're going to be talking about specifically iAssist, which is one of the many things that we offer in order to streamline access to specialty therapies. In today's day and age, the perception of the patient journey varies from probably each and every individual at these tables. And then, of course, the processes by which you complete those steps to getting a patient onto these complex specialty therapies is probably a little bit different from one to the next. But at the end of the day, our goal is really all the same, right? Get patients on therapy quickly, make sure it's a great experience for them and their caregivers, ensure we achieve the proper outcomes for those patients, and then for sure make sure that it's in as little bit of work and effort on that practice as possible, because we deal with so much and with such little resources. Let me just make sure I hit the right button. So today we're going to be talking about navigating these complexities and how you can simplify the process. But for the sake of just getting everybody engaged and making sure we're all awake, of course, I have to try to get some audience participation. So if you have a phone near you, I would love if you could go to menti.com, enter in this code, or scan this QR code. Really, it's just an opportunity to look at how you compare from your peers, one or another, in terms of the effort it takes to complete these steps and the overall impact on the practice. So the first is, of course, quickly obtaining accurate prior authorization forms and submitting them the appropriate way, accessing prescription cost options and financial assistance programs, and then lastly, accessing and completing the proper therapy-specific enrollment form. So if you could just take a quick second to do that, that would be great. I'm not gonna pull up the data on the screen because I wouldn't want to embarrass anybody for not completing this in person. However, I would imagine we would all probably see the very same thing, right? It's gonna be a high cost in terms of the effort and the impact to complete these steps, and it's really unfortunate, right? So why is it so challenging? We'll get into that in a moment here, but as you take this survey, please feel free to stop by our booth, 617, get a free reusable straw, sign up for the $75 drawing, and see how you compare to your other peers. Perfect, so we'll get into this now. What does the typical therapy journey look like? When we kind of look at as a whole that therapy and enrollment process for complex specialty therapies, when it's done by fax or even in some cases the MR, it is a pain in the butt. There are a lot of steps required in getting a patient started on therapy, and sometimes it can take weeks, sometimes months, and I wish it wasn't that way, especially in a day and age where you can call a car and it's there in 2 minutes. You can order something online, it's there the next day. We should be able to simplify this, and why is it so challenging? Really, I'm sure you all see this in your day-to-day, but it's because there's so much opportunity for missing information, inaccurate information, missing signatures, and that just elongates this process. So of course, what if we could streamline therapy initiation for every drug that you prescribe in your day-to-day practice in one location where every step is being completed prospectively in about 4 minutes or less without any room for error or follow-up steps. And then of course, what if you could even see the status of that patient every step of the way thereafter, so you know where they're at, that they're getting the care they need, that the drug was dispensed, and that you don't have any more work to do. Well, that is ultimately, of course, what we're here to talk about. This is the more streamlined enrollment process. And at AssistRx, we believe that access to therapy is facilitated through a blend of tech and talent. And that is really what drives positive health outcomes. Of course, when you leverage electronic tools like an iAssist, which is an intelligent therapy initiation platform, you're eliminating a lot of the guesswork, any of the room for missing information, the challenges with document uploads, and of course, that lack of visibility into the patient journey thereafter. And so we'll look at that a little bit further here. But iAssist itself is a multi-category, multi-therapy platform that you can access to prescribe any medication within your office. It is an e-prescribing platform that's SureScript certified, it's HIPAA compliant, it houses over 20,000 different prior authorization forms that are patient plan specific and product specific, and it actually is generated through direct integration with the payers and PBMs. It is facilitating the prescription of any FDA-approved medication that has an NDC number. It houses over 600 specialty therapy-specific enrollment forms in one place. It's completing the capture of electronic consent at the same time. It also covers comprehensive coverage information pulls for both medical and pharmacy benefits in one seamless workflow. All this is done in a way where it's completed in under 4 minutes. And as you can see, this workflow, that is an example, of course, streamlines each and every step that's going to be completed in the workflow. Now, one of the benefits to iAssist is that from one drug to the next, the experience for the user is almost identical. You're going down the process, completing the steps, tracking your progress, being notified when something's missing or there's additional information that's required. Now, but from one drug to the next, the logic that's built into that workflow is different. So the services that we're enrolling in, the steps that are required, the integrations that are powering it, the back-end stakeholders that need to get a copy of that enrollment, they're all going to be different, but the user doesn't see those complexities, and so it's just a much more, generally a better experience overall. When it comes to getting started, once that prescriber has made the clinical decision that this is the right medication for that patient, it's off to the races. So if you are not a registered user of iAssist, good news, it takes about 2 minutes for the entire practice to get up and running. And what that means is we get them registered, we capture and store the provider's signatures so that the staff can really act on behalf of that prescriber and facilitate the initiation of the therapy without chasing them down and looking for signatures and waiting for those updates. It also allows for the completion of any prescription in that workflow. So whether it's one prescription or multiple prescriptions at that exact same time, you're able to facilitate it. It's pre-populated, including the titration complexities, and then we route it to the correct pharmacy. In terms of pulling coverage, so the benefits of the patient are really what's going to dictate much of this workflow. iAssist, through direct integrations with payers, PBMs, partners like SureScripts, GoodRx, and other data resources, we're actually able to pull comprehensive patient coverage in real time and determine cost for the patient. So prospectively in that workflow, we're determining what is the out-of-pocket cost. When it comes to a pharmacy benefit product in 30 seconds or less, we're able to pull patient out-of-pocket costs, deductible met, restrictions, PA requirements, step edits, and that's for over 80% of covered lives. Again, in 30 seconds or less with first name, last name, date of birth, gender, and zip code, which is already going to be provided as part of that patient profile at the beginning of the workflow. Same thing for medical benefits. In 30 seconds or less, first name, last name, date of birth, gender, and zip code, we're pulling back individual and family out-of-pocket costs, minimums, maximums met or exceeded. And what that does is it not only just streamlines the process for you, the user, but on the back end, it eliminates a lot of the phone calls and the manual work that it takes to complete those details by phone. So in general, saving time for everybody involved and helping patients get on therapy quicker. As we move into eligibility screening, so iAssist is the only platform that allows for you to not only ensure we have patient coverage for both pharmacy and medical benefits, but it also allows you to, in real time, screen for eligibility for programs like PAP, copay, Quick Start, Bridge, in that exact same workflow. So it's not a separate process. We leverage e-income verification, so in real time, we're pulling patient household size and income to determine whether or not they are eligible for a PAP program. And by screening for them in that methodology, you eliminate the need oftentimes for supportive documents, proof of income, and those other documents that tend to slow the process down, whether it's by requesting it through a FedEx or a fax to that patient. It's skipping those steps and allowing that patient an immediate determination to move forward. In terms of copay, we're obviously screening through your traditional questions, but through an integration with that copay partner, it's generating a copay card in real time that can be downloaded for the patient in that moment. But better yet, we actually send it with the prescription to the pharmacy so that once they talk to that pharmacist, it's not about what may the cost of the drug be. It's about, hey, we already have a copay card on file. You owe $0 today. Where are we shipping this? And that is such a better experience for a patient who's already timid and nervous about getting started on a therapy and concerned about the cost burden to them and their family. Moving ahead, capturing consent. Consent is such a simple thing to capture, but it is almost always one of the most common reasons for a delay in getting a patient on therapy. especially if that patient has already left the office, right? So you're chasing them down, you're sending them messages, emails, and things to try to capture that, and it just doesn't need to be that way. So through iAssist, prescribers and their staff have two really simple ways of getting consent from a patient. If they're in the office, great. We can simply have the patient check off on attestations, type in their name. It creates a signature form. It applies it to all the fields on the document. And of course, in the event that the patient has left the office, it's just a matter of requesting by text or email the patient to complete consent through a link. It is very, very seamless and easy. We do this for the majority of our partners, and it cuts down days and hours, if not more, in getting consent. Let me hit the right button. Of course, the PA is always the biggest challenge, right? You look around this room, there are so many people and companies here trying to solve for the PA, and that's great. That is a challenge that needs to be resolved across the industry, and we need to team up to do that. When you think about PAs, though, it's oftentimes completed after the prescription or through a separate portal or through a separate document. So it's kind of a disparate step in the overall process. What we do with iAssist is we allow, especially after we've captured and determined patient coverage, we pull the correct prior authorization form, again, through the direct integration with the payer's PBMs. We auto-populate as much of the fields as we can with the patient-provider information that's already been collected in the workflow, and we only expose to that user the remaining fields that need to be required. And then, of course, it's sent directly through an integration to the payer PBM for a real-time determination on the back end that's letting the user know, hey, it was approved, it was denied, or there's more information that's required. Along with that PA, we also can include supportive documentation. So for example, at the point of completing the PA, along with the prescription, the consent capture, we're enabling a templated letter of medical necessity or letter of exception without creating any additional guesswork or wondering what fields to include. Those forms can dynamically change as we learn about the payers and what they're looking for and what is or isn't getting approved at certain payers for different patients. And of course, we also can include clinical documentation and notes. So whatever we can do to ensure that that PA is approved the first time and there's not additional follow-up steps for that practice, those are the things we're doing as we build these workflows for our partners and putting them in front of the user. And then lastly, once that prescription's written, it has to go somewhere. And sometimes there are multiple prescriptions. In the case where there's a PAP, Quick Start, Bridge prescription, we're able to route that directly to the non-commercial pharmacy at the exact same time as the prescription being sent directly to the commercial pharmacy for the maintenance dispense. What we often will do and what we typically see is that practices have their preferred SP, manufacturers, payers, PBMs have their preferred or required SPs. So we make it very blatantly obvious what those options are through a drop-down for the practice, again, based on the determination of a patient's coverage earlier in that workflow. So it's just incredibly simple to pick the correct pharmacy, because when you don't do that, what happens is that prescription may go to the wrong pharmacy, it needs to be triaged to a different pharmacy, and more cases than not, there's no visibility into that, and that patient kind of gets caught in the mix in the process. And they're not oftentimes able to advocate for themselves to get it moved to the correct pharmacy. So we want to avoid challenges like that as much as we possibly can. So when you look at this as a whole, AssistRx, our whole goal is streamlining access to therapies and reducing time to therapy from months, weeks, even days down into hours. It's all done through automation, electronic submission that's guiding that user down the pathway that's the least, going to offer the least resistance, and ensuring that everything is completed in one place for all therapies that have these complexities without having to navigate multiple portals and different pathways. So that being said, I hope this was helpful. We very much appreciate the opportunity to speak to you today. I believe that Atlas is up next, but of course, swing by, check us out at 617, see the results of the survey, grab one of the reusable straws, and enroll into the $75 gift card drawing. Thank you so much. Good to see you all.